Welcome to all my phenomenal panelists who need no introduction technically. But for our viewers and all our distinguished audiences over here today, we've seen how mental health in the past decade especially has evolved from becoming just conversations to headlines. But there's still a gap, especially when it comes to practice, and especially when it comes to medicine. And today's conversation, through this conversation, could we please fix that audio? We do intend to sort of bridge that gap that is still existing. And we as women, I'm sure Kavya would also agree with me, sense it every day. We had a conversation about that. But to focus on the policy aspect of it, Dr. Gangadhar, I want to quickly bring you in as somebody who's been a veteran in this field of mental health with over 4 decades of experience as a former director of NIMHANS and with the NMC. Do you think mental health as an issue was always as burgeoning as it is today?
Mental health issues have been in the forefront for the last 4 decades, definitely. But a lot of contributions have happened from the mental health professionals, medical education and medical health department, and also from the public. Things have changed, and the support that the mental health is now getting by the state and also by the professional is much, much higher than what we thought it would have happened.
Do you think that the NMC is doing enough to push medical colleges into making it a core sort of
it is
aspect?
a very, very important question. NMC, of course, is about 5 years old. Before that, there was the Medical Council of India. And from the 1950s plus, ever since the Medical Council of India has been operating, there has been a need to push mental health into medical curriculum, because mental health remained in the 40-odd mental hospitals away from the health mainstream. And so it has to be brought into the mainstream, and this is precisely what happened over the course of time. And way back in 1980s, this issue of training undergraduates in mental health became a focus. And the need for creating general hospital psychiatry units became important. And all the medical colleges were expected to have a general hospital psychiatry unit. And somewhere a little later, the mandate came that a medical college must have a department of psychiatry, with a psychiatrist being there. And little later, it was even further defined. You need to have so many beds, you need to have a professor, you need to have a faculty, and so on and so forth. And very recently, 2023, we also developed what is called as the competence-based medical education curriculum and competences for mental health, which is very important. And of course, thanks to the Indian Psychiatric Society, which also kept the pressure on both the the Medical Council of India and the National Medical Commission. Now, there is a 30-mark question paper also is available, which is a part of a medicine examination. Psychiatric questions, undergraduates are expected to answer these questions.
I'm glad that you're highlighting that evolution, because that's why I want to quickly bring in Dr. Parikh. Dr. Parikh, this has been a very gradual evolution, as is being highlighted by Dr. Gangadhar. Having said that, we were having that conversation and you said it was always an elephant in the room. But given that, say, data is now coming to the forefront, how have you assessed or observed the changes in the last decade, especially when there's been so much talk about how mental health has been impacted in the last 5 years, post-pandemic especially?
No, see, I think WHO has itself mentioned in its 22 report that post-pandemic there was a 20-25% increase in anxiety and depression.
Yes.
But like I was telling you just while we were having this conversation, I think it's very important to understand that it's not that COVID has brought mental health. One needs to understand it was always there. As much as it was before, yes, there may have been a rise, but that does not take away the fact that mental health, the prioritization of mental health is still in its, like sir was saying, an evolution. But I think the evolution needs to be a lot more faster. Given that the world is moving at a much faster pace, I was just listening to the AI. I think healthcare community, by and large, needs to really push the importance of mental health. And I think we will all need to understand that mental health will not be only about experts. It will also be about advocacy, which is where these conversations also matter. You in media have a significant role to play, because it's not merely it's not the science that's the problem here. It's the stigma that prevents the access to the science, which is a bigger problem. And once you start breaking that stigma, take science to people, that's where change will happen. And that change, I think, is still a bit far away to my satisfaction, because the percentage of people who could be helped and who don't seek help grossly outnumbers people who are able to seek help.
There's stigma. That change has to happen at a societal level, and then only say questions regarding access arise. First, it has to be an admission and acknowledgement, which is why today's conversation is titled Let's Talk. Let's talk, Kavya. As women in these fast-changing times, I feel a burnout every day. And I admit it. I feel a burnout every day because as a society, I feel this is the burden of emancipation. We've taught women to take to the labor force, but we've not perhaps taught the opposite gender how to accompany a woman who's actively taken to the labor force. How do you speak to concerns regarding women like us? You're flying back today itself.
Yes, I am.
You flew in last night without even giving yourself time to breathe where you are. So how does one manage such a schedule?
See, this culture goes far behind. Okay, this culture starts from the time that हमारे देश में जब एक लड़की पैदा होती है, तो अभी भी बहुत ज़्यादा जगहों पे ऐसे बोला जाता है that अरे वी वॉन्टेड अ बॉय, लेकिन कोई बात नहीं, हम तुमसे भी बहुत ज्यादा प्यार करते हैं. तो जब एक लड़की पैदा होती है ना, शी इज बॉर्न इटसेल्फ विद गिल्ट दैट ओ माय गॉड मे बी दे वांटेड समबडी एल्स. अब ये लड़की का रोल तो निभा ही रही है, क्योंकि उसकी फैमिली उसको वही सिखाती है कि ये तुम्हारा रोल है, ये तुमको करना है, लेकिन अब उसको लड़के का भी रोल निभाना है. And then to match up with the rising expenses and the rising expectations, कि अगर आप किसी 2-tier city से 1-tier city 3-tier city पे आप शिफ्ट कर रहे हैं, तो the society is also telling you that औरतें और भी तो काम करें, आप घर को भी मैनेज कर सकते हैं, आप करियर को भी मैनेज कर सकते हैं. You have to bring in the money in the house. No man wants to be in the shoes of a woman ever. Is there any man here who wants to be in the shoes of a woman? But every woman wants to be in her own shoes and in the shoes of a man. Now there is double load. Men have it slightly easier. I love the men. Men work very hard. I'm not saying they don't. They do a fantastic job. But traditionally the role of a woman is also, अगर उसका बच्चा सही नहीं कर रहा है तो तुम नहीं देख रहे हो, अगर उसका किचन सही नहीं चल रहा है तो तुम नहीं देख रहे हो. There is a lot of additional load on the woman, so she can't rest. और अब जो हम millennials हैं, जो इतना struggle कर रहे हैं that no, we have to be perfect here and here and here, the Gen Z is watching us and learning. तो अब Gen Z का stress भी हमारा stress है, हमारे पेरेंट्स का स्ट्रेस भी हमारा स्ट्रेस है. Where are we going to go?
Millennials have seen it all.
Yes.
Dr. Gangadhar, the Mental Health Care Act, it mandates rights-based care. That's why I want to ask you, are we able to sort of keep up with the legislation in terms of the rights that are provided?
Yeah, the Act has come. Act emphasizes the rights of the individual. And I believe all doctors cared for the rights of the individual all the time. There could be exceptional situations, leave apart, that could happen in any society. But more important is, we as psychiatrists, I know, I'm sure my colleague will also agree, that we believed that the individual's rights prevail over all other things, including issues of consent, giving treatment even when this person is very disturbed. And all the times, if the patient is not in a position to give consent, we believe his rights are guarded by his own kin, the parent, the father, mother, wife, whoever it is. We take their consent to make sure that the treatment is instituted. So the rights has always been on the top priority. For various reasons in the past, this was taken for granted. Now this has come into a document. This is number one. So rights based. At the same time, the rights of the caregivers is also very important, because in India we don't exist individually, we live with the family members. So how much of the family members' concerns are also factored into in ensuring the rights of the individual is a balance that we are all striving to do it. But be assured that the rights of the individual who is now in a very precarious scenario of a compromised mental health state, mental health condition, is always guarded by the profession.
Dr. Parikh, what is that one myth that families keep bringing to you time and again, and you wish could finally be done away with?
I mean, it's not one, unfortunately. That's the sad part.
Go ahead.
But raising,
highlight, share. That's the idea. Talk.
But from blaming the individual for an illness, right? Expecting the illness to go away by some breathing exercises and some walks in the morning, or some avocado, or complete refusal when it comes to medications, significant reluctance to start medication. Enough people around you will tell you don't take them. A handful might tell you to take them, and then soon they'll be telling you that now get off them. Yesterday I had this conversation with an individual who was telling me about, these medications have dependence. I'm a thyroid patient for the past 30 years. If I miss my 75 mcg of thyroid, I won't be able to function, right? So am I dependent on it? Is it an addictive aspect? We don't ask those questions, right? I'm on an inhaler, not very surprising where we live, but I'm on an inhaler now for a decade or so. If I miss it out, then I start having a bit of discomfort. Is it dependence? So some of these aspects
Are you also observing the role of lifestyles, changing lifestyles?
We have to accept it.
We are all living in a capitalist society now.
Yeah. And I also
where there's
feel
so
that
much focus on, say, materialistic joy, that we're also
on the
not focusing on things that matter.
Since you mentioned this, and I want to just share one thought that came to my mind when Sir was speaking. I feel when it comes to mental health in India, I think the government sector has done a far, far, far superior job than the private sector has done. And to me, that has been one of my biggest concerns. That today, when you talked about space, you look at the kind of work that is happening, not just NIMHANS, but otherwise also, it's tremendous. Telemanas, tremendous. But when you now look at it, the comparative, these large networks of healthcare, who build these tertiary care networks, they've really failed mental health as a system. You won't find, you will go to a general hospital setup like Sir was saying, and you'll have a psychiatry department, a psychiatry ward, a psychiatry place, a well-formed program, and you won't find it as well in private healthcare. I think that's one of the things. And when it comes to lifestyle, to me, the single lifestyle change which continues to give me concern is the digital usage. I firmly believe that there will be enough evidence coming over the next few years, and we will have a significant impact on our neurocognitive, neuropsychological thinking processes.
I'm glad you
because of the kind of digital usage.
That's exactly I want to talk about to Kavya as well. Kavya, the role that social media is playing, because there's so much focus on the physicality of being. Do you think that's also taking a toll, not just on the younger generation, on the way women want to view themselves, the way men want to project themselves? A lot is now become about social posturing.
I want you to literally think about us as we are all addicted. And the social media addiction is known to be as severe an addiction as gambling. Can you imagine every single person in a family being a gambler and what that can do to you? But earlier there were world wars and there were cold wars, and now there is an attention war. There is a war about how many likes did you get and how many likes did I not get. People don't want to be physically, emotionally involved with other people anymore, so they're becoming more and more lonely. That is a huge problem, and more addicted to the screen. Because of the fact that somebody else looks better or somebody else has something more than I have, each member of the family today is spending the money that they don't have to buy the things that they don't need to impress the people who don't even like them.
So what is that one practice that you would advise everyone? I have to quickly wrap this session now. So quick 30 seconds in terms of how can I lead a better quality of life in these changing times?
Go back to your basics. Go back to what your body needs. Dr. Gangadhar will agree. He's worked on integrating yoga. Just your physical health, your relationships with people. Unfortunately, we only see the importance of these when somebody dies. But we have a very short attention span. And then we go back to the rat race. You're not supposed to be competing. With who are you competing? With an algorithm. That competition needs to go off.
Dr. Gangadhar, there are times when jobs don't even give you that half an hour or 1 hour for your body and mind. Do you think such jobs are even worth it?
Say it again.
There are times when your jobs don't even give you an hour's time for your mental well-being.
Yeah, all of us have to look after ourselves first before we look after the others. This is very important, I believe, which applies to all of us here. And the way of looking after ourselves is to be fit, physically fit and also mentally fit. And then, of course, exercises, as she mentioned, yoga, to be away from what we may call as alcohol, drugs. These are the issues which I think we need to focus on. Pay attention to my own health. I'll be doing a best job for my patients.
Dr. Parikh?
Three quick ones. Meaningful relationships. They will not be on text. They will certainly not be on emoticons and certainly not on reactions, and they're not made out of reels, and they're not on social media platforms. Meaningful relationships. As we call it, say this in Adayu, adding value to Ayu, adding value to life. Mental health adds value to your life. Nothing else adds value to your life. So if you don't take care of your mental health, your life will not have the value that it could have. And the third quick one, in a generation of hashtags, unmute yourself, speak, baat karo, kisi bhi karan se baat karo, kuch bhi baat karo.
All right, hashtag no hashtag. Thank you so much. All right, I do see, sure. Could somebody please give you a mic? Hello, Sensei, how are you? Absolutely.
Yeah, and men also have this, both many responsibilities, burdens, equal. It's that you cannot shrug away from your caregiving part. Like you have to take care of the child, you have to take care of the in-law. That man cannot do. It's the mutual work. So, men's mental health, I have been urging Gangadhar sir to make a men's mental health committee. Because it's very important.
That's why we said when we speak about women getting emancipated, we have to also keep in mind how men have to take to that emancipated role of women. It's a very good question, actually.
Men cannot cry, one thing is, and mard ko dard nahi hota, but I believe feelings have no gender.
Very true.
So why men's mental health committee?
Neither does mental health.
Yes,
So mental health also doesn't have a gender. So I think as a society, we need to treat people as people and not put them in categories, including of gender. And that's the only way to look at it.
Every special population, mental health issues have been looked at. Children, women, elderly. Now, men are not so special. Maybe they are.
Because it's also been a man's world for a very long time. But I'd like Kavya also to add to that.
I think the Gen Z and the Gen Alpha are changing everything. Okay, they're doing everything different from what we could not do. So the attention on the men's mental health is also coming up, and you will see the change in the next 2, 3, 4 years.
And it's like yin and yang. You can't do one without the other. So, as I said, if women have to be liberated, men also will have to be trained. I'm sorry, I'm running short of time, so we'll have to quickly wrap it at that. I'm sure you all enjoyed those voices from lived experience to medicine and practice all. Thank you so much, ladies and gentlemen. Thank you.